Good afternoon and welcome back to our third teleconferencing session. Now we'll be discussing about nursing management of a patient with schizophrenia, and we'll talk about actually the general management, in which we'll talk about the medical management and highlight the nursing management. The experts you have already seen are with us. Immediately to my right is Mrs. Raminder Kalra, and to my extreme right is Ms. Mitali Dey. Both of them are from Rajkumari Amrit Kaur College of Nursing, University of Delhi. We are very grateful to both of you to be here, and I'm sure students are going to really interact and get a lot of advantage. May I ask the regional centers, other than of course Ludhiana, Jaipur, Hyderabad, you can also call us Khanna, no problem if you have any doubt, but the other centers also kindly let us know whether the students are attending today's teleconference or not. Well, let's talk about the management first, and in management we'll talk about the medical management. When we talk about schizophrenia, we do discuss what is schizophrenia and what are the different types of schizophrenia. But when we talk about the management, there are certain drugs common for the schizophrenic patient, and also the nursing management related to the schizophrenia. Mrs. Kalra, would you like to highlight what is some of the medical management of the patient with schizophrenia?
Yeah, when we talk about the management of the patient, as we said earlier, that all patients do not require hospitalization, and majority of the patient can be treated at home. It is the family support which is required along with the medications, which is very important. And that is what we call it as integrated approach. Integrated approach is that along with the medications you have other approaches also. That means there is a family support, there is psychotherapy being given to the patient, and also there is counseling being done for the patient. The other therapies are included, which we are going to discuss. Like first one is family intervention under that. Family intervention is very important. We have learned about the family, the psychodynamics also, because they do not have proper ego development basically during early childhood. Now what is required is that they get proper family support, proper communication. The family members have to understand that these people are important members of family, and like physical illness, schizophrenia is also one of the illness. If brought early for treatment, the prognosis of schizophrenia is much better, and it is 50% cases are not going to have second episode if they have proper treatment in time taken for patients suffering from schizophrenia. And then is early treatment, that we are already emphasizing. Early treatment is very important. There is no need for a person to hesitate. One has to overcome the stigma of going to a psychiatrist for treatment. One has to identify the symptoms and go for treatment to a psychiatrist so that the medicines can be started early along with the family support. The medicines which can be given, pharmacotherapy, the list of the medicines which can be given are, we have got two types of antipsychotics, that is typical antipsychotics and atypical antipsychotics. Antipsychotics are also called as neuroleptic drugs. Can we have the slide please?
Sure.
We have the list of the drugs there. Now under neuroleptics we have got haloperidol is one very common drug. We have got chlorpromazine, haloperidol, thioretisine. Then there is Sarentil, trifluperazine and fluphenazine. Now these are available in tablet form, some of these are available in injectable form, and some of the drugs, when the patient is not taking the treatment, he is getting recurrent relapses because of not maintaining the compliance with the treatment. There are long acting antipsychotics like fluphenazine deconate, that is anantin salt deconate or haldol deconate preparations available, the injection of which is required once in 2 to 3 weeks, and the effect is there for longer time. Now then there are also atypical antipsychotics which are available. Any of these medicines can be started. Atypical antipsychotics have less side effects as compared to typical antipsychotics, and these days they are being preferred. They include like clozapine. Then there is risperidone. Risperidone is considered to be very good for negative symptoms of schizophrenia when the symptoms are more of withdrawn and not much of hallucinations and delusions are present. It is social withdrawal which is there. The person is not attending to the personal hygienic needs. For such type of symptoms, risperidone is considered to be a very good drug. Other than that, in certain cases, ECT might be given. ECT, though the first indication for ECT is depression, but in certain schizophrenic patients, like especially catatonic excitement and catatonic stupor patient, also may respond well to electroconvulsive therapy. Or in certain cases, if they are not responding so well to the medicines, along with the medicines, ECT may also be given. Then another one is we have psychosocial therapies. Under psychosocial therapies, behavior therapy is one of the things which can be given. Behavior therapy can be in the form of token economy, like the person is not maintaining hygiene. You keep telling the patient every day that you maintain hygiene, go for bath. The day the patient takes bath on his own, he is given a token, and when a number of tokens are collected, the patient is given some reward. So these type of behavior therapies can be of help to the patient to improve the symptoms. Then family therapy, that means to prepare the family to restore the problem quickly when it emerges at home. The family members are taught how to handle the various situations at home. If there is any problem at home, how to bring all the people of the family together, discuss and come to the common consensus and come out with the problem. Then there is cognitive therapy. Cognitive therapy helps to improve the thought process in the patient. It helps to reduce the distractibility and helps a person to improve in judgment. Then another type of therapy is group therapy. Group therapy, as nurses, we can also practice, where we collect a group of patients. It could be the homogeneous group or heterogeneous group depending upon the disease condition. There the group members, they discuss about some common issue, some common problems, and many times it is found that other patients, they themselves are able to help the other patients to come out with a solution for their problem. They are able to correct the distorted behavior of the patient. Maybe a person gets up frequently in between the group therapy session, and it is the other patient who point out, no, it is the group therapy session going on and you must sit down. When it is their own one of the members pointing out, it is found to be more effective. So group can influence and can help the patient to improve the behavior. Then another one is individual psychotherapy. Supportive psychotherapy is very important in these patients. Patient can be helped to understand their illness, patient can be helped to understand their own behavior, and can be again taught about the importance of maintaining compliance with the treatment.
So we have the psychopharmacological, that means psychopharmacology therapy, where we give the typical antipsychotic and atypical antipsychotic drugs to the patients. We also have the physical therapy, which you discussed about electroconvulsive therapy and psychosocial therapies. And studies have shown that if the combination of drugs, as you very rightly said, and ECT is given, the improvement is much better, and if the combination of all the three therapies is given, the patient recovers faster.
But one thing which I just like to add up here is that these drugs, they take little time to start their action. Most of the time it happens that the patient has taken medicine for 1 week and there is not much of improvement. They immediately change the doctor. Now this doctor is not good, let us go to some other doctor. These medicines are going to take time to start their action. It is not that the patient is having fever, you give a paracetamol and the patient fever comes down immediately. So it's important that the medicines have to be taken for 2 to 4 weeks to actually show their action. And in case the patient is having certain side effects of the medicine, it can be brought into the notice of a psychiatrist. You can go back to psychiatrist, discuss about the medications problem which are coming up, and if required, maybe some other drugs are given, like anti-Parkinsonian drugs may be given, or it could be that sometimes when the side effects are so severe and difficult to tolerate, then some other antipsychotic could be started. So one should not stop the treatment, increase the medicine or decrease the medicine on own. Many times they feel that now that the patient's symptoms are settling, let us decrease the medicine. Doctors are not decreasing the medicine, let's decrease on our own. That's wrong, because then that causes more frequent relapses of illness. One must maintain, and even if the patient is asymptomatic, the medicines have to be taken for certain duration and should not be stopped on own.
So, having discussed about the medical management of patient with schizophrenia, it is important for you to know, as nursing personnel, to know that how do we manage a patient with schizophrenia as nurses. Let's discuss about the nursing management and how do we go about of discussing the nursing management is important. Mithali, would you like to highlight about the nursing management?
Yes, ma'am. Nursing management, as we are talking about, it is very clear that whenever the patient is in contact with you, then only we start with the nursing assessment or management. Now, management starts when the basically patient is admitted to the ward, specific ward, that is into your ward, and you are also, might be you are assigned to that particular patient. Then only nursing management starts for that particular patient. Now, when we are talking about nursing management, it starts obviously with nursing assessment. Now, this nursing assessment, according to your textbook, it has been divided into three, that is the assessment of the patient, assessment of the family, and assessment of the patient's background. Now, assessment of the patient, when we are talking about, we usually apply one particular examination activity that is called as mental status examination. Now, I'll talk about that later on, but through this mental status examination, we try to know about the specific things about the patient. That means right from when you see the patient, how he is dressed, his general appearance, how he is looking, like is he tensed, is he in a state to answer you, or he is agitated. So these are the various observations you will make about the patient, and these observations in a way will help you to start up with your conversation with your patient. Because if before you start up with your procedure, you have to have a relationship. That relationship we call as rapport. Now, this rapport has to be built only when you know about the patient. So before you know about the patient, you have to assess his mood, and then only you can go forward. Now, in this assessment, as I have talked about, like you have to see general appearance, what mental state he is in, and with by seeing the general appearance, you have to also know about his mood and affect, whether they are congruent. Then also you have to see that whether he is perceiving, what is his perception, whether there is any hallucinations, as already been discussed earlier. Now, hallucinations are various types that you have to read more deeper, but you have to see in the case of perception whether there are hallucinations, whether there are illusion. Now, these are the two varieties of perceptual disorders. You also have to see that there are thought disorders. Now, for thought disorders, there are three types of thought disorders. They are being in form, in progression, and in content. That means in the form whether his thinking is rational or it is irrational or illogical, whether he is having autism or autistic thinking, which we have talked earlier, whether he is withdrawn to himself or he is relating to the people outside, that is, or to the environment. So you have to observe in the form of thinking. You also have to see the progression of thinking. Now, thinking cannot be seen. Thinking can be judged by his speech. So you have to see how he is talking, whether he is having neologism, which is, or he is having words alas, that you have to see. And again, in the case of content, you have to see whether he is having delusions or whether he is having any this phobias and all. These things you have to see. Besides that, these are about the various specific about the patient. Now you have to see about the family. In the family, he is attached to which particular person. Is there any breakup with that particular person, or there had been any traumatic experience related to that person? Now, what is his role in the family? Does he play any responsible role in the family? That also you have to know. And also, like as we have talked, in the family, the communication matters a lot. So you have to study whether there had been any double-bind communication or not. So that you have to judge. You have to find out by talking to him. Now, when you talk to the patient, he may not be giving all the correct information because of his state. So you have to have a patient's relative to ascertain whatever information you have collected from the patient. Now, after that you have judged about the family, you have also to see his environmental relationship. Now, in the case of environmental relationship, you have to see whether he is able to formulate friendship or relationship, whether he is able to initiate his conversation with opponent or whomever he is meeting. So these are the various assessment in nursing management. So we always start with nursing assessment which is not written here is mental status examination. You can go through about the mental status examination.
That's very important, because that's one observation which gives you the holistic view of patient's condition. And as you were discussing under the assessment of the patient, the mental status examination, that means you see to the consciousness level, you see to the all the thought, perceptual, affect, intelligence, all the levels you see of the patient, and then you are able to make the nursing diagnosis. So very important is that whatever we are doing the assessment, it is leading us to make the nursing diagnosis of the patient so that we can do the proper intervention. What are some of the nursing diagnoses of patient with schizophrenia?
The list of the nursing diagnoses we have got, you have learned about the nursing process. Assessment follows by nursing diagnosis. Now, nursing diagnosis is the symptoms which are written in diagnosis form. It is not the same as medical diagnosis. Medical diagnosis could be catatonic schizophrenia or the catatonic schizophrenia or other type of schizophrenia. But when we talk about nursing diagnosis, they are like, first one is withdrawn behavior related to disordered thought process, or it could be, because basically it is a thought disorder. Withdrawn behavior could also be related to feeling of fear or suspicion. The patient, as Madam Itali was talking about, that the patient is having paranoid delusions, patient is suspicious, so there could be withdrawn behavior related to feeling of fear or suspicion. Then there can be...
May we have the slide, please? The slide, please.
Then there could be withdrawn behavior related to delusions and hallucinations. Because of the delusions, that is false fixed belief that the person has got, the patient may withdraw. Because of the hallucinations, which could be auditory or visual hallucination, patient may withdraw. Or it could be withdrawn behavior related to misperceptions of environment or other person. Then another one is low self-esteem related to inadequate interpersonal relationship. There is problem in interpersonal relationship, and low esteem could be because of they are not able to establish good interpersonal relationship. Then low esteem related to lack of successful coping strategies. Low esteem could also be related to delusions or hallucinations. Low esteem could be, once you're doing the assessment, it can be in the form of that the patient is not able to maintain eye-to-eye contact, patient does not feel confident. These all may indicate that the person is having low esteem. Another one is disorientation. Now, this disorientation can be related to disordered thought process. When the thought is not progressing properly, when the content is not proper, that can lead to disorientation. Disorientation can also be related to hallucinations or delusions. It can also be related to misperceptions of environment, and that is why in mental status examination, once we are doing that, we are also assessing the orientation level, and that helps us to come to these diagnoses. Another nursing diagnosis is potential for injury, which can be to self and others. When we were talking about the symptoms, we did say that there can be the patient becoming violent. The violence could be the violence can lead to potential for injury to self and others. That means they can cause harm to themselves or to others, and it could be related to disordered thought process, delusions or hallucination. Patient feels that he is hearing some voices. It could be commanding voices, it could be there is some thought insertion. The patient feels that there is a delusion of control, somebody is controlling their activities, so they might injure other one coming out of the hallucinations and delusions that they get. Or it could be potential for injury to self or others related to feeling of worthlessness and threat that they have. Then hallucinations or delusions related to disturbed thought process. Then can be hallucinations or delusion related to disturbed perception. Then another one is potential for disturbed homeostasis related to effect of medication. Medications have their side effect, and that could make the person, maybe the person is feeling very thirsty, patient is not maybe drooling saliva. There can be various disturbances. Then it can potential for disturbed homeostasis. Homeostasis can also be related to inadequate food or fluid intake. Since the patient may be overactive, may not eat anything, the patient might be not taking properly, which can lead to again disturbance in homeostasis. Could be because of suspicious ideas that some poison is added to the food, or somebody is trying to kill me. Because of that also the patient may just have inadequate intake of food. Then potential for disturbed homeostasis may also be related to disturbed sleep pattern. Then there is bizarre behavior, which could be anxiety, agitation or aggression, which may be related to feeling of fear and suspicion. It could be related to lack of control over self and or environment. And the bizarre behavior could also be related to disturbed thought process. So these are some of the nursing diagnoses which can be formulated.
Well, I think this is very important that you have known that what are how do we do the assessment of a patient with schizophrenia, and then what are the, how can we make and what should be the probable nursing diagnosis. Let us see how do we plan the care of these patients. Mitali,
Yes, ma'am.
would you like to highlight how do we plan the care of patient with schizophrenia now that we know that how do we do the assessment and make the nursing diagnosis?
Yes. So this, after we make identify or make the nursing diagnosis, we have to plan out certain activities for the patient, which we call as intervention. Now in the planning phase, we always have short-term goals and long-term goals. Now these short-term goals are more specific and long-term goals are far-reached. Now short-term goals, you can find that you take up small activities, like if you have found the patient was not taking care of himself, so you can say that he is taking his food, having a sound sleep, having a rest. He is maintaining with the basic needs of the body. So it can be in the form of rest, sleep, food, hygiene. So these all will come in your short-term goals. There are others, like he is also participating in therapeutic milieu. That means in the environment in the hospital, wherever he is being admitted, he is participating to the whole process of the treatment. Then also you'll see that when the patient comes, he might be very violent. He might have injured himself, he might have injured others. So he might be in a state of injuring self. So you have to see and you have to identify the goals that he is free of injury. So this can be one of the short-term goals. That means another short-term goals can be he has maintained